Welcome to this deep dive, and today we're taking on the world of mental disorders using, well, excerpts you provided from DSM-5 made easy. We're going to try to really, unlock how those diagnoses actually happen, because I think there's this kind of misconception that it's just like checking boxes in a manual.
Oh, absolutely, yeah. It's way more nuanced than that. It's not just about ticking off symptoms, on a checklist. It's about looking for patterns, degrees of similarity. It's really fascinating stuff.
So, walk me through that process a bit. How does a mental health professional actually use the DSM-5?
Okay, so picture this, right? The DSM-5, it gives these prototypes, which are basically detailed descriptions of different disorders. Clinicians, they use those prototypes as a reference point and then compare a patient's experiences and behaviors to see which prototype fits best.
So it's almost like having this mental image of what each disorder looks like in a patient.
Exactly. And to fine-tune that even more, they actually use a 5-point scale to assess the degree of that match.
Okay.
So a 1, that means there's very little resemblance to the prototype. But a 5, oh, that indicates a classic textbook case.
So it's not just, yes, you have this, or no, you don't. There's a whole spectrum of how well someone's experiences match that description.
Precisely. And here's something else that's super important to keep in mind. The DSM-5, it's an amazing tool, but like all tools, it has its limitations, right? Just because a specific disorder isn't explicitly listed in there doesn't mean, boom, it doesn't exist. Our understanding of mental health, it's always evolving. New research is coming out all the time. So the DSM, it gets updated to reflect all that.
Right. It's an ongoing process.
Absolutely.
So with that foundation set, I'm really curious to kind of dive into some specific types of disorders. And let's start with neurodevelopmental ones, the ones that typically emerge during childhood. Autism spectrum disorder, or ASD. That's a big one.
ASD is a great example, and it really illustrates that concept of a spectrum. It's not a one-size-fits-all diagnosis. It can look so different in different people. You have individuals with high verbal abilities, like Temple Grandin, for example.
Oh, wow. Temple Grandin,
Yeah.
the animal scientist
Yeah.
and autism advocate. I've always been so impressed by her. So incredible to see how someone with ASD can, thrive and achieve amazing things.
Absolutely. And a key characteristic of ASD is persistent challenges in social interaction and communication. Um, Difficulty with back and forth conversation, understanding social cues and, those nonverbal things like body language, building lasting relationships, those sorts of things.
Those interactions that most people kind of take for granted, those can be a real struggle.
Exactly. Now, shifting gears a bit to another neurodevelopmental disorder that I think, is really relevant, attention deficit slash hyperactivity disorder, ADHD. And here's the thing. It's not just a childhood condition. It can really impact adults too.
You're so right, because there's this misconception that it's something you just outgrow, but it can persist and create, real challenges in adulthood. So talk about that diagnosis a bit. What are clinicians looking for when they're diagnosing ADHD?
We're looking for this persistent pattern of inattention, hyperactivity, and impulsivity that's been present since childhood. So think of that classic image of, the child who's fidgeting, interrupting, struggling to stay on task. Now imagine those same traits, but they're impacting work, relationships, responsibilities in adulthood.
Right. It's not just being scatterbrained. It's bigger than that.
Exactly.
That makes you realize how important early identification is. So,
Yeah.
people can get the support they need early on,
Yeah.
especially when you think about how ADHD can impact other areas like learning.
Absolutely. And speaking of learning, conditions like speech sound disorder and specific learning disorder, those are also usually identified during childhood, and they can have a lasting impact.
What are some specific examples of those?
Sure. So speech sound disorder, it involves difficulty producing speech sounds correctly. So this could be, like a lisp or saying wobbit instead of rabbit. And it might seem, like a small thing, but these challenges can make it really hard for a child to be understood, which impacts their confidence, their communication.
It's got to be so hard for a child to, feel self-conscious about something as natural as speaking.
Yeah, absolutely. And then there's specific learning disorder, which involves persistent struggles with things like reading, writing, or math. So imagine, a child who's bright, capable, but they're consistently falling behind in school despite their best efforts.
Right.
Early intervention can make a world of difference.
Now, we've talked about some conditions that are often kind of misunderstood, but psychotic disorders, I think, top that list. And what comes to mind for most people is hallucinations. But I'm guessing there's a lot more to it than that.
You're absolutely right. One of the biggest misconceptions is that, hallucinations are just vivid daydreams.
Right.
But in reality, these are sensory experiences that feel completely real to the person experiencing them. Imagine hearing voices as clearly as you and I are hearing each other right now,
Wow.
but there's no one else in the room. That's the level of intensity we're talking about.
Wow, that's a really powerful way to put it. So it's not just someone with like an active imagination.
Right.
It's a completely different way of experiencing the world.
Precisely. And often a hallmark of psychosis is a lack of insight, meaning that, individuals might not even recognize that their hallucinations or delusions, they're not real. And this is a crucial factor when we're diagnosing conditions like schizophrenia.
Okay, so let's talk more about schizophrenia, because that is a term people hear a lot, but I think there's often a lot of confusion about what it actually is
Yeah.
and what it looks like.
Right. To illustrate this, let's consider a case from the DSM.
Okay.
Natasha K. is a young woman who began experiencing these vivid hallucinations. She was hearing voices. She believed she was under constant surveillance. Her speech became increasingly disorganized. Her behavior grew erratic and withdrawn. These experiences, they caused significant distress in her life, and it made it really hard for her to function normally.
So her thoughts and behaviors were just like totally out of touch with reality.
Yeah.
But to her, those experiences were very real,
Exactly.
even though they weren't based in like actual events.
And these symptoms, they really align with the diagnostic criteria for schizophrenia, which requires this combination of, what we call positive symptoms. So that's like hallucinations and delusions, and negative symptoms like reduced emotional expression or difficulty experiencing pleasure.
And it's important to remember that everyone's experience with schizophrenia is going to be unique. The severity and the specific symptoms, they can vary a lot.
Absolutely. There's no single, face of schizophrenia.
Right.
And there are other disorders within that psychotic spectrum, each with their own unique presentation.
Like what? Give me some examples.
Sure. So you've got schizophreniform disorder, which looks a lot like schizophrenia, but tends to be shorter in duration. So think of it as like a temporary state of psychosis that may or may not develop into full-blown schizophrenia.
So there's a possibility of full recovery with that
There
one.
is. And then you have delusional disorder, where persistent, non-bizarre delusions, they really take center stage.
Okay.
So imagine someone who becomes utterly convinced that their partner is cheating on them, even though there's absolutely no evidence to support it. Their belief is unshakable, even in the face of, contradictory proof.
Those delusions can be incredibly powerful.
They are. They really are.
Wow. Well, we've talked about conditions that are often misunderstood, but mood disorders, I think that's something that on some level we can all relate to.
Oh, for sure. Mood disorders are something that touch so many lives, and it's really eye-opening to understand the nuances. And when we talk about mood disorders, we're really getting at those significant shifts in mood and energy levels that, they really disrupt a person's ability to function in their everyday life.
Right. And when we're talking about these shifts, major depressive disorder,
Yeah.
that's one that comes to mind immediately. And I think a lot of people, they can relate to feeling down, sad, but a major depressive episode, that's a whole other level, isn't it?
Absolutely. This isn't just having a bad day or even a bad week. This is a persistent low mood that just casts a shadow over everything. We're talking loss of interest in things you used to love, fatigue that just won't quit, even physical symptoms like, changes in sleep, appetite, the whole nine yards. And it's really important to assess for suicidal thoughts. That's something we definitely don't want to shy away from.
You're so right. It's a heavy topic, but so important. Because if someone is experiencing a major depressive episode, their thoughts, they might turn to suicide. It's crucial to remember that help is available, and no one has to go through this alone.
100%. Reaching out is so important. Now, to really understand another mood disorder, bipolar disorder, it's helpful to kind of break down these two key states, manic and hypomanic episodes.
Okay, so break those down for me. What are the key differences there?
Okay, so imagine mania like this runaway train. It's this period of really intense, elevated mood energy that lasts for at least a week, sometimes longer. It's like someone hit fast forward on their life, but they don't have the remote. They might be super talkative, have racing thoughts, take on risky behaviors, have trouble sleeping, and in some cases, they might even have psychotic symptoms.
Wow, that sounds really intense and potentially dangerous, not just for them, but for others around them too.
Yeah, it definitely can be. Hypomania, on the other hand, it's kind of a milder version of this elevated state. It's like turning up the volume on life. You've got more energy, creativity, you're productive, you feel great, things seem effortless. But, and this is key, it doesn't usually last as long. We're talking a few days, and it doesn't lead to that same level of impairment that you see with mania.
Okay, so with hypomania, someone might be like more talkative, energetic, more productive, but they're not necessarily like out of control.
Right. And understanding that difference is really important because it helps us tell the difference between bipolar I disorder, which is
Yeah.
where you see those full-blown manic episodes, and bipolar 2, which is characterized by those hypomanic episodes.
Got it. Got it. So if we were to like look at a case study here, let's say Brian M. He experienced these periods of feeling incredibly low, lacking motivation, having trouble sleeping. He was really struggling with these intense feelings of worthlessness. His energy was just zapped, and he even contemplated suicide. And these episodes were so bad that they actually led to hospitalization. So what does that sound like to you?
So Brian's case really sounds like a textbook example of major depressive disorder. And it's important to really emphasize here that depression, in the true clinical sense, it's not just a phase, it's not a sign of weakness. This is a real medical condition, and it can really impact every single aspect of a person's life. But, and this is the good news, with therapy, medication, or combination of both, many people, they find relief and they learn how to manage those symptoms effectively. That is so important to remember, that there are effective treatment options out there. It's about, seeking help, finding the right approach for each individual. Now, kind of switching gears here to another, I think, really common mental health concern, anxiety disorders. I mean, we all experience anxiety from time to time, but when does it cross that line and become a disorder?
That's the million-dollar question, right? And you're right. Everyone experiences anxiety. It's a natural human response to stress or, things we perceive as threats. But with anxiety disorders, those feelings of fear, worry, they're persistent, they're excessive, and they're out of proportion to what's actually going on. And that's when they start to interfere with a person's ability to, work, maintain relationships, even just go about their day-to-day life.
Right. So give me an example of like a specific anxiety disorder that really illustrates that point. Okay, let's talk about panic disorder. So picture this. You're going about your day, everything seems fine, and then bam, out of the blue, your heart starts racing, you can't catch your breath, you feel dizzy, and this wave of overwhelming fear just washes over you. It feels like you're having a heart attack, like you're losing your mind. The whole 9 yards, that's a panic attack.
Yeah, I've heard people describe panic attacks, and it sounds absolutely terrifying, like their whole world is just crumbling around them.
They are incredibly frightening, and for people with panic disorder, these attacks, they happen repeatedly and often without warning. So you can imagine this unpredictable nature, it can lead to this constant fear of having another attack, which makes it hard to relax, to go out, to do anything really.
Right, and that makes me think of agoraphobia, the fear of being trapped in situations where escape might be difficult or help might not be available. Is there a connection between those two?
You are spot on. They often go hand in hand because for someone with panic disorder, the thought of having an attack in a crowded place, on public transport, any situation where they can't easily escape, it can be debilitating. So this fear leads them to avoid those situations altogether, which really impacts their quality of life.
It's like this vicious cycle, right? The fear of the panic attack, it fuels this avoidance, which then reinforces the fear.
Exactly, exactly. And then you've got social anxiety disorder, another anxiety disorder that can be incredibly debilitating. Imagine feeling this intense fear, this anxiety,
Yeah.
in everyday social situations. And it's not just being shy or introverted. This is a crippling fear of judgment, scrutiny, humiliation, just from interacting with others.
So this could be something like, public speaking, meeting new people, even just like ordering food at a restaurant.
All of that, absolutely. For someone with social anxiety disorder, these everyday things can feel just completely overwhelming. They might worry about saying the wrong thing, being judged, even having physical symptoms like blushing or sweating that they think are embarrassing.
It breaks my heart to think about people living with that level of anxiety. It
Mhm.
really makes you realize how strong people are, the human spirit, and it just highlights how important it is to approach mental health with compassion and understanding.
You're so right. Speaking of conditions that often elicit a lot of misunderstanding, let's talk about obsessive compulsive and related disorders.
Okay, and this is one where people tend to, throw the term around casually, like, oh, I'm so OCD about keeping my desk clean. But real OCD, it's so much more complex than that, right?
It really is. Obsessive compulsive disorder, or OCD, is marked by these intrusive, unwanted thoughts, images, or urges, we call those obsessions. And they trigger intense anxiety, distress. And to try and make that distress go away, people engage in these repetitive behaviors or mental acts, and those are the compulsions.
So it's like being stuck in this loop almost of anxiety-provoking thoughts and behaviors that they just can't seem to escape.
Exactly. And these obsessions and compulsions, they can be incredibly time-consuming, often taking up hours of a person's day. And, that's time they're not spending doing the things they need or want to do.
For someone who hasn't experienced it, it's got to be really hard to grasp how debilitating that can actually be.
You're absolutely right. And it's important to make that distinction between, OCD and like everyday worries or preferences. It's not just about liking things a certain way. These obsessions and compulsions, they're intrusive, they're unwanted, and they cause real distress.
What are some other disorders that kind of fall under that same umbrella?
Okay, well, there's body dysmorphic disorder. So that's where someone becomes fixated on this perceived flaw in their appearance. And it's a flaw that, others might not even notice, but they might spend hours checking themselves out in the mirror, grooming excessively, or constantly seeking reassurance about their looks.
It's like their reflection becomes their own worst enemy, almost.
Yeah, that's a really good way to put it. And then there's hoarding disorder, which is characterized by this extreme difficulty discarding possessions. And we're not talking about, a few cherished items. This is regardless of their actual value. This can lead to, extreme clutter in their homes, making it, honestly, sometimes hard to even live there and often causing distress in other areas of their lives.
Wow. It's like those are all such powerful examples of how our thoughts and our behaviors, they can kind of work against us sometimes and create these huge challenges in our lives.
They really are. And it really speaks to the power of the human mind, both its resilience and its vulnerability to these complex conditions.
Speaking of conditions that can really have a hold on people's lives, let's turn our attention to substance use disorders, because this is a topic that, affects millions of people worldwide. And I think there's a lot of there are a lot of misconceptions surrounding addiction.
Oh, absolutely. Substance use disorders, they're not about a lack of willpower. They're not about making bad choices. These are complex brain diseases. And they're characterized by this compulsive use of drugs or alcohol, even when there are really harmful consequences.
So it's not just about how much someone drinks or uses drugs. It's about the control, or lack thereof, that the substance has taken over their life.
Precisely. The cravings can be so intense that they override logic, reason, even self-preservation. We're talking loss of control over use, continued use despite negative consequences, and often this physical dependence that leads to withdrawal symptoms when they try to quit.
And those withdrawal symptoms can be really rough.
Oh, absolutely. Depending on the substance, the severity of the addiction, we're talking nausea, vomiting, tremors, seizures, hallucinations, intense cravings, the whole gamut. And that's why it's so, so important to seek professional help when you're trying to overcome addiction.
It's not just a matter of, quitting cold turkey. It's about navigating this potentially dangerous process with the right support.
Exactly, exactly. And it's so important to remember that addiction, it doesn't discriminate. It can affect anyone, regardless of age, race, gender, socioeconomic status.
And it often co-occurs with other mental health conditions, right?
You're absolutely right. It's rarely just one thing in isolation. Now, this next category, it delves into like the foundation of who we are, our personalities.
Personality disorders. Now, this is a fascinating one because it really gets at how we think, feel, and interact with the world. So when does a personality trait become a disorder? Like, where's that line?
That is the question, isn't it? It's kind of a million-dollar question. Think of it this way, okay? Everyone's got a unique personality. Quirks, strengths, weaknesses, that's what makes us us. But when those patterns of thinking, feeling, and behaving, when they become inflexible and they cause significant distress, or they start to impair a person's life, that's when it crosses over into the territory of a personality disorder.
So we're not just talking about someone who's a little quirky or set in their ways.
Right. We're talking about pervasive, inflexible patterns that are causing real problems in their relationships, at work, just their overall well-being.
Can you give me some examples of different personality disorders to kind of illustrate that?
Sure. So let's start with schizotypal personality disorder. Imagine someone who really struggles to form close relationships. They might have these unusual perceptions or beliefs, And their thoughts and behaviors, they can be a little eccentric, which makes it hard for them to fit in socially.
It's like they're always on the outside looking in, never quite feeling like they belong.
Yeah, that's a good way to put it. They might have these odd beliefs, they might engage in magical thinking, have trouble reading social cues, or even have these unusual speech patterns that are, difficult to follow. Now, on a completely different end of the spectrum, let's talk about antisocial personality disorder.
Oh, okay. That's the one that's often linked to, like criminal behavior.
Right. To a certain extent, yes. But it's important to remember that not everyone with antisocial personality disorder is a criminal. However, what they do share is this common thread of disregard for and violation of the rights of others. So they might lie, cheat, steal, act impulsively, and they often lack remorse for their actions. And that, of course, can lead to some pretty serious interpersonal and even legal problems.
It's amazing how different, how diverse the presentations of personality disorders can be. Ranging from those who really struggle to connect to those who seem to lack any empathy at all.
It's true. It's a wide spectrum. And it's crucial to keep in mind that these disorders often come from this complex mix of things: genetic predispositions, childhood experiences, environmental factors. It's not a choice, and judging someone based on a diagnosis is never helpful.
Well said. It's all about empathy and understanding. Now, this next category, it delves into a topic that's often surrounded by a lot of secrecy and frankly, stigma: paraphilic disorders.
This is definitely a complex and sensitive area, so, let's be mindful as we discuss it. So, paraphilias involve these intense and persistent sexual interests that deviate from what we consider typical or socially acceptable. But, and this is the key here, a paraphilia, just having it doesn't automatically mean someone has a disorder.
Right. It's about the impact those interests have on a person's life and whether they're causing harm either to themselves or to others.
Exactly. It's when those interests cause significant distress, impairment in a person's life, or, when they involve harm or the risk of harm to others, that's when we start talking about a paraphilic disorder.
So take exhibitionistic disorder, for example. And individuals with this disorder, they get sexual arousal from exposing their genitals to unsuspecting strangers.
Right. And we're not talking about a harmless prank or a one-time lapse in judgment. This is a pattern of behavior. It's driven by this compulsion, and it can have very real consequences, legally, socially, you name it.
It's about recognizing that there's a difference between, healthy sexual expression and behaviors that cross boundaries and can potentially harm others.
Precisely. Now, another paraphilia that tends to, pique people's curiosity is fetishistic disorder. And this one involves intense sexual arousal from non-living objects or non-genital body parts.
Okay, so we could be talking about anything from shoes and lingerie to feet or hair.
You got it. And again, it's important to stress that just because someone has a fetish, it doesn't mean they have a disorder. It's about that level of distress, that impairment it's causing in their life.
It's about understanding when something that, might be considered a little unconventional becomes this source of real problems, or it starts interfering with their relationship, their daily functioning.
Exactly. Yeah. Now, this next disorder is one we need to talk about with, the utmost seriousness and sensitivity because of the potential for harm, and that's pedophilic disorder. This disorder involves intense and recurrent sexual attraction to prepubescent children.
And this is a disorder that causes, immense suffering and has devastating consequences for victims. It's absolutely essential for anyone struggling with these urges to seek professional help immediately.
You're absolutely right. Early intervention, treatment, they're critical to managing these urges, preventing harm, and ensuring the safety of children.
Now let's shift gears to a different category of disorders that can really impact a person's quality of life, and that's sleep-wake disorders. We all have sleep problems sometimes, but when do those problems cross the line into a disorder?
That's such a good question, and it's one a lot of people can relate to. We all have those nights where we just toss and turn. We can't fall asleep, or we wake up in the middle of the night and can't get back to sleep. But sleep-wake disorders, these are characterized by persistent sleep problems that are causing significant distress or impairment in someone's daily life. We're talking difficulties falling asleep, staying asleep, or even excessive sleepiness that starts to affect work, relationships, just their overall well-being.
So it's about the severity of those sleep problems and how much they're impacting the person's life.
Exactly. Let's take insomnia disorder, for example. People with this disorder consistently struggle to fall asleep, stay asleep, or they wake up too early even though they've had plenty of opportunity to sleep. And that can lead to daytime fatigue, trouble concentrating, irritability, the whole 9 yards.
I know when I don't get enough sleep, I feel like I'm walking through mud. It's awful. I can't imagine dealing with that all the time.
It can be truly debilitating. And there are a bunch of things that can cause insomnia. Stress, anxiety, depression, medical conditions, certain medications, even just bad sleep habits.
So it's not always as easy as telling someone, oh, just get more sleep.
Exactly, exactly. Often it requires a deeper look at what's going on to find the right treatment strategy. Now, another common sleep-wake disorder is obstructive sleep apnea hypopnea. This disorder, it involves these repeated pauses in breathing while someone's sleeping, and it often comes with loud snoring.
Oh, right, like that classic image of someone snoring so loud it shakes the walls.
Yeah.
But it's more than just an annoying noise, right?
Right. Those pauses in breathing, we call them apneas, they happen because the airway gets blocked, partially or completely,
Yeah.
usually by the soft tissue in the back of the throat. So this disrupts sleep, leading to daytime sleepiness, fatigue, all that. But what most people don't realize is that untreated sleep apnea, it can up the risk of some serious health problems. We're talking heart disease, stroke, high blood pressure. It's not something to mess around with.
So if you're someone who snores, like really badly, it's important to take that seriously and talk to a doctor.
100%. Okay, let's talk about a group of sleep-wake disorders that are often misunderstood. Circadian rhythm sleep-wake disorders.
Okay, so these are the ones where there's a mismatch between a person's internal sleep-wake cycle and their external environment, right?
You got it. And a prime example of this is shift work disorder. So think about working the night shift, or maybe you've got these constantly rotating shifts. Your body's trying to stick to its natural rhythm, but your work schedule is like, nope, not going to happen. And that can lead to some serious sleep deprivation, daytime sleepiness, and just overall difficulty functioning.
Right, it's like your body is constantly fighting against itself.
Exactly. And it's not just shift work. Jet lag is another really common example of a circadian rhythm sleep-wake disorder.
Oh yeah, that feeling of being totally out of it after, traveling across time zones. I've been there.
We've all been there. Your body needs time to adjust to that new time zone, and until it does, you get hit with fatigue, insomnia, trouble concentrating, stomach issues, the whole shebang.
Speaking of feeling out of sync, let's talk about a category of sleep-wake disorders that, I'll be honest, I find a little creepy, and those are the non-rapid eye movement sleep arousal disorders.
Oh, yeah. These are the ones that involve those weird, sometimes unsettling episodes of partially waking up from sleep. Often they come with these unusual behaviors, experiences like sleepwalking or sleep terrors.
Sleepwalking, okay. So that's where someone literally gets out of bed and walks around while they're, like, sound asleep.
That's it. They might walk around the house, open doors, even try to cook a meal, all while they're completely out of it. And they usually have this blank stare on their face. And the really creepy part, they don't remember any of it the next morning.
Okay, yeah, that would be very unnerving to witness. What about sleep terrors? Are those different from nightmares?
Good question. So while both involve, scary experiences during sleep, they're different in a few key ways. Nightmares, they usually happen during REM sleep. That's when we dream most vividly. And we often wake up remembering those nightmares really clearly. Sleep terrors, on the other hand, happen during deep non-REM sleep, and they involve these sudden episodes of screaming, intense fear, physical symptoms like a racing heart, sweating, even thrashing around in bed. And the really freaky part is people usually don't remember these episodes when they wake up.
So with sleep terrors, it's like you're plunged into this state of absolute terror, but you don't even have the comfort of knowing what scared you afterward.
Yeah, it's a really disturbing experience, both for the person going through it and anyone who happens to see it. And finally, let's touch on nightmare disorder. This one involves these recurring, vivid, disturbing dreams that often wake someone up, leaving them feeling scared, anxious, unable to get back to sleep.
I think most people have had a nightmare at some point, but with nightmare disorder, these nightmares are a regular thing, and that can really mess with someone's sleep and how they feel overall.
Exactly. And the content of those nightmares, it can be very disturbing, often involving themes of danger, persecution, helplessness, things like that. And the emotional impact of those nightmares, it can linger long after waking up, causing anxiety, fear, difficulty falling back asleep.
It's like the nightmare follows you into your waking life.
Exactly. And it's really important to remember that sleep-wake disorders, they can have a huge impact on someone's life. And they're often tied to other mental health conditions like anxiety and depression. So getting professional help, it's crucial to get a proper diagnosis, figure out any underlying causes, and come up with a treatment plan that works.
Absolutely, because sleep is so fundamental to our physical and mental health. And speaking of fundamental aspects of well-being, let's transition to a topic that's often considered taboo, but is so important to address: sexual dysfunctions.
You're right. It's not the easiest subject to talk about, but sexual health is a key part of our overall well-being, and these disorders, they can cause a lot of distress and put a real strain on relationships.
So let's dive in. When we talk about sexual dysfunctions, what exactly are we talking about?
Basically, these are conditions that interfere with a person's ability to experience sexual desire, arousal, or orgasm, and they can show up in a lot of different ways. And it's really important to be sensitive and understanding when we talk about this because there are often these complex psychological, interpersonal, even physical factors at play.
So give me an example of like a common sexual dysfunction.
Sure. Let's start with erectile disorder. It's more common than people realize, especially as men get older, and it involves this persistent difficulty getting or keeping an erection that's firm enough for intercourse. Now, a bunch of things can cause this: stress, anxiety, problems in a relationship, underlying medical conditions like diabetes or heart disease, even certain medications.
So it's not always like a purely physical problem.
Exactly. The mind and body, they're totally connected when it comes to sexual function. Sometimes the root cause might be primarily psychological, like performance anxiety or relationship issues, but sometimes it might be more physical, like a hormonal imbalance or a side effect from a medication.
That makes sense. And it just goes to show how important it is to, talk to a professional to figure out what's going on and find the best treatment.
100%. Now, another common sexual dysfunction that can be really distressing, especially for men, is premature early ejaculation. This is when a man ejaculates sooner than he wants to, either before or right after penetration.
Yeah, I can imagine how frustrating and embarrassing that would be.
It can be a huge source of stress and anxiety for men, impacting their self-esteem, their relationships. It's a big deal.
So what causes premature ejaculation?
The causes aren't always totally clear, but it can be a mix of things. Psychological factors like anxiety, stress, relationship issues, but also biological factors like hormone imbalances or hypersensitivity.
So it's interesting, like similar to erectile disorder, how it can be both psychological and physical.
Exactly. Now let's switch gears and talk about female sexual dysfunctions. One that we hear about a lot is female sexual interest arousal disorder. This one involves a really significant decrease in or absence of sexual interest or arousal.
So we're talking about like a lack of interest in sex, difficulty getting aroused,
Yeah.
even a lack of pleasurable sensations during sexual activity.
Yep, that's it. And as you can imagine, this can have a huge impact on a woman's quality of life and her relationships. The causes, again, they can be multifaceted: hormonal fluctuations, medical conditions, psychological factors like stress, anxiety, even history of trauma. And let's not forget about relationship dynamics, too.
It's like all these different parts of a woman's life can come together and influence her sexual desire and arousal.
That's a great way to put it. Now, another female sexual dysfunction that we need to talk about is genitopelvic pain penetration disorder. This one involves pain during intercourse or other attempts at vaginal penetration.
That sounds incredibly painful and distressing.
It really can be. And the causes, again, often complex, could be physical things like infections, vaginal dryness, muscle spasms, but it could also be psychological factors like anxiety, fear of pain, or a history of sexual trauma.
It's like the body's trying to send a message that something's wrong, but figuring out what that message is and how to address it can be tough.
Exactly. It often takes a team approach involving doctors, physical therapists, and mental health professionals all working together.
And then there's female orgasmic disorder, which involves the persistent delay in or absence of orgasm,
Yeah.
even when there's enough sexual stimulation.
Right, and this can be so frustrating and distressing for women, often leading to those feelings of inadequacy or like a disconnect from their bodies and their partners.
What are some of the things that can cause female orgasmic disorder?
Well, like many of the things we've talked about, the causes are complex and often multifaceted. We could be talking about psychological factors, stress, anxiety, depression, a history of sexual trauma. There could be physical factors too, like hormonal imbalances, certain medications, or underlying medical conditions. And of course, we can't underestimate the role of relationship dynamics, communication, and even just like societal expectations surrounding female sexuality.
It's like trying to solve a puzzle, where you have to look at all the pieces to understand the bigger picture.
Exactly. The key is to approach sexual dysfunctions with empathy, understanding, and a willingness to consider everything that might be contributing to the problem.
Well said. Speaking of conditions that often require a really holistic approach to treatment, let's move on to gender dysphoria. This is a topic that's gotten a lot more attention and understanding in recent years, and I think it's so important that we discuss it with sensitivity and accuracy.
Absolutely. It really is. And, at its heart, gender dysphoria, it's not just about like being different or non-conforming. It goes way deeper than that. It's about experiencing this really significant distress because of this mismatch between a person's assigned sex at birth and their deeply felt internal sense of gender identity.
So we're talking about something much more profound than like just experimenting with gender expression or challenging societal norms.
Exactly. Yeah. It's this internal conflict, this feeling deep down that something's not right, that who they are on the inside doesn't match the sex they were assigned at birth. And this distress, it can show up in a lot of different ways. Like a strong desire to get rid of certain physical sex characteristics, a longing to have the characteristics of the other gender, or this persistent feeling that, their thoughts, their feelings, even their mannerisms just feel more aligned with their experienced gender than their assigned
It's
sex.
like they're living in a body that doesn't feel like their own.
Yeah, that's a really powerful way to put it. And it's so important to understand that this can cause a lot of pain, a lot of suffering. We need to approach this topic and the people who are experiencing this with empathy, respect, and understanding.
Absolutely. Now, let's shift gears a bit and talk about a category of disorders that often shows up in childhood and can be really challenging, and that's um, disruptive impulse control and conduct disorders.
Yeah, this category really gets at that struggle with self-control. These disorders, they involve problems with emotional and behavioral regulation, and that often leads to impulsive actions, difficulty with authority, conflicts with other people.
So what's an example of a disorder that falls into this category?
Well, one that's pretty common is oppositional defiant disorder, or ODD. It's often diagnosed in childhood. Think about a child who's constantly arguing with adults, defying rules, blaming everyone else for their mistakes, and just generally having a tough time controlling their anger and frustration.
Okay, so this is like beyond the typical terrible twos or teenage rebellion.
Exactly. It's this ongoing pattern of negativity, defiance, hostility that goes beyond what's considered developmentally normal at that age. And it causes problems at home, at school, in their relationships.
And if it's not addressed, can ODD turn into something more serious?
It definitely can. In some cases, it can escalate to conduct disorder, which involves a more severe pattern of violating other people's rights and just, breaking societal norms. We're talking aggression towards people and animals, destroying property, lying, stealing, and just like serious rule
So
violations.
these are behaviors that can have some pretty serious consequences, not just for the individual, but for everyone around them.
Absolutely. It's recognizing that these behaviors, it's not just kids being kids. It's a sign of a deeper issue with impulse control and emotional regulation, and it needs to be addressed. Early intervention is key here to help these kids learn how to cope in healthy ways and develop better patterns of behavior.
It's about giving them the tools to navigate the world in a way that works for them and for everyone around them. Now, this next disorder, it's one that I'll admit the name kind of throws me off a little, and that's intermittent explosive disorder. It sounds, well, intense.
It can be, yeah. This disorder involves these recurring outbursts of anger and aggression, and they're way out of proportion to whatever's happening.
So we're not talking about someone who just has like a short fuse or gets frustrated easily.
Right, right. These are explosive episodes: rage, verbal abuse, physical aggression, even property destruction. And they're often triggered by things that other people might see as, just minor annoyances.
So it's like the intensity of their reaction doesn't match the reality of the situation at all.
Exactly. It's like a volcano erupting over a spilled glass of water. And these outbursts, they can have some really serious consequences: relationship problems, job loss, legal issues, you name it. But the good news is there are effective treatments, therapy, medication that can help people manage their anger and prevent those destructive outbursts.
That's good to hear.
Yeah.
Okay, the next disorder we're going to talk about, I have to say it's one I find a little unsettling. Pyromania. It sounds like something out of a movie.
It does, doesn't it? But it's a real disorder, and it's characterized by this fascination with fire and this urge to set fires that they can't resist. And I don't mean like enjoying a bonfire or, being curious about matches. This is different.
So it's like a compulsion, this urge they feel like they have no control over.
Exactly. They might feel this tension, this excitement building up before they set a fire, and then afterwards they feel this sense of relief or even gratification. And this isn't just about like lighting a candle or starting a fire in the fireplace. We're talking about deliberately setting fires in a way that could hurt people or damage property.
Yeah, that's scary.
It is serious,
Yeah.
and it requires professional help to get at those underlying psychological issues and find ways for them to cope with those urges that are safe and appropriate.
It's about channeling that fascination into something constructive, not destructive.
Exactly. Okay, let's shift gears again and talk about a category of disorders that I think is especially relevant today with all the pressure around body image and weight. And those are feeding and eating disorders.
And this is a big category. It includes a lot of different disordered eating patterns, but the common thread is this preoccupation with food, weight, and body shape.
Right.
Got it. And it's so important to remember that these disorders aren't about vanity or a lack of willpower. They're complex mental illnesses, and they can have serious physical and psychological consequences.
So let's start with one that I think most people have heard of, and that's anorexia nervosa. This one's really serious. It's a life-threatening eating disorder, and it's characterized by this relentless pursuit of thinness, a distorted body image, and this intense fear of gaining weight. People with anorexia, they restrict their food intake to an extreme degree, often to the point of starvation. And they might exercise excessively or engage in purging behaviors like making themselves vomit or misusing laxatives.
It's heartbreaking to think about someone being so afraid of their own body that they would literally starve themselves.
It's a really tough one, and it needs professional help right away. The physical effects of anorexia, they can be devastating. Malnutrition, heart problems, organ damage, it can even be fatal.
So early intervention is critical.
Absolutely. Now, there's another eating disorder that often gets confused with anorexia, and that's bulimia nervosa. Both of them involve a fear of gaining weight and a distorted body image. But with bulimia, it's this cycle of binge eating and then purging.
Okay, so what does that cycle actually look like?
So imagine this. You feel totally out of control, and you eat a huge amount of food in a very short period of time, often in secret. And afterwards, you're hit with this wave of shame, guilt, and this desperate need to undo what you've done to get rid of the calories. That's where the purging comes in. Self-induced vomiting, misusing laxatives or diuretics, exercising like crazy.
That sounds both physically and emotionally exhausting.
It's a vicious cycle, and it's really hard to escape without help.
And then there's binge eating disorder. And that's where you have the binge eating, but without the purging, right?
That's right. People with binge eating disorder, they have these recurring episodes of uncontrollable overeating, and they often feel really ashamed and guilty afterwards. And of course, that can lead to weight gain and other health problems. But the key difference here is that those binge eating episodes aren't followed by those compensatory behaviors, like purging.
Right. And I think it's important to remember that these are just a few examples of the many different feeding and eating disorders out there. But the bottom line is, if you or someone you know is struggling with disordered eating, getting professional help is essential.
I couldn't agree more. The earlier the intervention, the better the chances of recovery.
Well, we have covered a lot of ground in this deep dive. We've really explored a lot of different mental disorders, from depression and mania to personality disorders, impulse control. It's been quite a journey.
It really has. And if there's one thing I want you to take away from all of this, it's that mental health matters. These disorders, they're real, they affect millions of people, and they deserve our attention, our empathy, and our understanding.
And remember, seeking help is not a sign of weakness, it's a sign of strength. There's always hope, and recovery is possible. And on that note, that wraps up our deep dive into the DSM-5. Thanks for joining us on this journey.